Did you know that many strokes begin even before breakfast? My name is Dr. Ricardo Lima, neurologist, and today I need to warn you about something hardly anyone talks about, but something that can completely change the course of your life, or the life of someone you love. Imagine this. A 74-year-old retired man wakes up like he always does. He notices his arm feels a bit weak, but he carries on. Goes to the bathroom, tries to grab his toothbrush, drops it. In less than 10 minutes, he can no longer speak. His stroke began before the day even really started. I've been treating cases like this for over 30 years, and what hurts me most isn't seeing someone lose their speech, movement, or memory. It's knowing that in many of these cases, a small change in the morning routine could have prevented it all. The first minutes of the day are a minefield for the brain. Your body is still waking up, blood pressure is rising, reflexes are slow. And it's in this quiet, repetitive window that risk hides. Today I'm going to show you the 5 most dangerous morning habits for people over 60. And more importantly, I'll show you what to do instead, in a simple, practical way that can preserve your clarity, autonomy, and your life. What's at stake here isn't just your health, it's your ability to keep living with clarity, with presence, and with dignity. If you want that for yourself or for someone in your family, comment now, "I'm here," and subscribe to the channel, because today, your routine can shape your future. Mistake. João had always been strong. He woke up early, made his own coffee, went out for walks, until that Sunday when he got out of bed feeling like his right arm was kind of numb. He tried to speak, but his voice came out slurred. He shook his head, let out a nervous chuckle and said to himself, "Nonsense, it must be age." 2 days later, João had a stroke. I wasn't surprised. It followed the pattern. Signs like mild weakness, sudden dizziness, slurred speech, or trouble smiling symmetrically are not just signs of aging, they're brain alarms. It's the body saying, "Help, something's not right." These symptoms often indicate a TIA, a transient ischemic attack, a silent warning that a real stroke could happen within 48 hours. And the most dangerous part is the male habit of ignoring it, pretending it's nothing. The classic, "It'll pass soon." But it doesn't pass. It comes with a cost, and sometimes that cost is too high. So here's a simple test you can do every day when you wake up. Look in the mirror, smile, raise both arms, and say, "Today is a good day." If any of these gestures don't come out right, go straight to the doctor. Mistake 2. Evelyn was a retired nurse. She worked 40 years in hospitals. She knew how to spot danger signs, guide patients, handle pressure. But in her own routine, she made a small, yet devastating mistake. It was a weekend. Her daughter was visiting, schedules changed. The day flew by. On Saturday, she forgot to take her morning medicine. On Sunday, too. On Monday, when she remembered, she decided to take a double dose. She thought, it's just to balance things out. By Tuesday, she was unconscious in the ER, hemorrhagic stroke, 6 months without being able to speak, months of rehabilitation, and her memory never fully came back. This is a common, silent mistake that doesn't care about education level, profession, or good intentions. Medication errors, skipping a dose, taking it at the wrong time, adjusting the dosage on your own, put the brain at risk exactly when it needs the most stability. In the morning, the body undergoes intense physiological adaptation. The heart speeds up, blood pressure naturally rises, blood vessels contract. It's the body waking up. But for those with high blood pressure, diabetes, or vascular problems, this wake-up requires balance. And that's where medication comes in, or should come in. Think of your brain as a dam. Medication is the gate that controls the flow. Without it, what seems calm turns into an internal flood. And unlike a sore arm or a fever, a stroke doesn't give second chances. A lot of people think it's okay to just take meds with coffee, to skip a day, or that doubling the dose will make up for it. But medication doesn't work like bank debt. You can't just make up for it the next day. And the issue isn't just forgetting, it's the lack of structure in the routine. Disorganized pillboxes, no fixed schedule, confusion with similar-sounding names. All of this contributes to a risk that grows without you even noticing. And when the stroke hits, it's always a surprise, but never without warning. Mistake 3. Charles always started his day the same way. He'd get up, splash water on his face, and go straight to the kitchen. Coffee was almost a sacred ritual. Strong, black, no sugar, and on an empty stomach. He said it was the kick his body needed, until the day he fainted with the mug still in his hand. He fell sideways and hit his head on the floor. Ischemic stroke. At the hospital, the diagnosis was clear. Sudden spike in blood pressure, blocked brain vessel. It all started with a habit that seemed harmless and that he had repeated for years. A lot of people do the same. They get up, still dizzy, and drink coffee before putting anything else in their body. But what feels like energy is actually a shock to the system. During sleep, the body slows down its activity. Heart rate drops, circulation slows. When you wake up, there's a delicate restart process, and coffee, especially on an empty stomach, disrupts that process abruptly. Caffeine triggers the release of adrenaline and cortisol. It's like flooring the gas pedal, with the engine still cold. You force your heart to race, your blood vessels to constrict, your blood pressure to spike, all at once, and without any food to cushion the impact. For those over 60, especially with a history of high blood pressure, diabetes, or high cholesterol, this sudden jolt can be the exact trigger for a stroke. Coffee itself isn't the villain. The problem is the order of events. No water, no food, no preparation, and it becomes a spark in a dry field. The solution is simple, but it requires awareness. It's not about cutting out coffee. It's about respecting your body when you wake up. Because what seems like a routine could be the mistake that puts your brain at risk. Mistake 4. Darlene had a simple routine. She would wake up, grab her phone, and spend a few minutes reading messages before getting up. That was her moment. But on that particular morning, something got out of control. When she finally got up to go to the bathroom, she took 2 steps and collapsed. Blood pressure through the roof. Mild stroke. In the ambulance, she kept asking what she had done wrong. And the answer even surprised her children. She held her urine every morning. It sounds like a small detail, a delay of 5–10 minutes. But inside the body, that gesture sets off a dangerous chain reaction. When you wake up, your bladder is already full. Holding it increases the levels of adrenaline and cortisol, stress hormones. And what do those hormones do? They constrict blood vessels, raise heart rate, and most importantly, raise blood pressure. At that moment, the brain is still adjusting to waking up, and the pressure spike combined with dehydration and muscle tension creates the perfect storm for a stroke. Holding in urine first thing in the morning is like inflating a balloon that's already full. You don't see the pressure building from the outside, but inside, the risk of rupture increases by the second. And it's not just about stroke. This habit affects kidney function, can cause recurring urinary tract infections, and increases the risk of fainting and disorientation-related falls, all because of a choice that often doesn't even feel like a choice, just a habit. Getting up and going straight to the bathroom should be automatic. No distractions, no phone, no, "I'll just answer this message." Your body spent hours storing fluids. Your systems need to restart with relief, not extra pressure. Ignoring that basic need may seem small, but it's exactly those small omissions that, added together, create space for tragedies that once seemed far away. Mistake 5. Ray is 74 years old. He grew up in the countryside, raised 3 kids, and never liked wasting time. He always said, "You wake up, you get up, a body at rest gets rusty," and that's what he did every day, without thinking, without giving the body any time. One ordinary Saturday, he did what he always did. He opened his eyes, turned over, swung his legs out of bed and stood up immediately, took 2 steps and collapsed. No tripping, no warning. His wife ran to him, called for help. At the hospital, the diagnosis, stroke caused by a sudden drop in blood pressure upon standing. Ray's speech was impaired, and he lost part of his motor coordination, an automatic, routine gesture with permanent consequences. Sleep is a deep process. The body slows down. Circulation settles into a slower rhythm. During the night, blood flow decreases, vessels expand, blood pressure drops. Waking up, on the other hand, is a gradual process, or at least it should be. When you get up abruptly, the blood that was evenly distributed suddenly shifts, mainly to the legs. The heart tries to compensate quickly, but the brain is the first to feel the change. That brief moment of instability can lead to dizziness, fainting, loss of balance, and in critical situations, a stroke. Especially in people over 60, this compensation mechanism is already naturally slower. The arteries are stiffer, the nervous system responds more slowly, and blood pressure tends to fluctuate more. In other words, what used to be a harmless habit is now a real risk. Think of the body like an old car. If you start the engine and immediately hit the gas, something's going to break. But if you wait, warm it up, ease into it, it runs better and lasts longer. The key lies in that very adjustment. When you wake up, take 3 deep breaths while still lying down. Slowly move your hands, feet, and ankles. Sit up slowly on the edge of the bed. Wait 10 to 15 seconds. Only then stand up, gently. This simple ritual prepares the brain, heart, and circulation for the transition from rest to activity, and it can mean the difference between an ordinary day and a medical emergency. Ray still lives in the countryside, but now he wakes up slowly, and he often repeats something he learned the hard way. The rush to get up almost cost me the ability to walk. In over 3 decades of treating neurological emergencies, I've seen many bodies fail. But before that, I've seen something even more dangerous: silence. Especially among men, there's a deep resistance to listening to their own bodies. It's not a lack of information, it's conditioning. From a young age, men are taught they must endure. That pain goes away, that weakness should be hidden, that asking for help is a sign of inferiority. This mindset disguises itself as strength, but in practice is a pact with risk. Men don't die younger only because of biology, but because of neglect. They go to the doctor less, talk less about what they feel, distrust preventive advice, and tend to delay even basic care. And the body, which is loyal, keeps sending signals, with fatigue that won't go away, with subtle dizziness, with occasional forgetfulness, with that feeling of something's not right, but which is ignored until it can't be anymore. This behavior has a name: self-neglect. And it's deeply tied to an outdated idea of masculinity. In most of the stroke cases I treat, the phrase always comes up, "He never complained about anything," as if that were a virtue. It's not. Complaining in this context means recognizing a sign, noticing a flaw, acting early, and often preventing a tragedy. The brain always tries to warn before it fails, but if you've been trained to silence your own signals, the cost might be too high. Scheduling an appointment is not a sign of weakness. Taking your medication on time is not overreacting. Listening to your body is not a waste of time. That is maturity. That is self-care. That is survival. And more, this is responsibility toward those who love you. Because when a man has a stroke, the pain isn't his alone, it's his wife, who suddenly becomes the sole caregiver, his children, who lose a present father, his grandchildren, who don't understand why their grandfather now struggles to speak. Breaking this culture of silence is more than a health decision. It's an act of self-love and love for others. You might be 60, 70, 80 years old, but it's never too late to do things differently, to listen more, to take better care of yourself, and to give your body the chance to keep carrying you wherever you want to go. Many people believe health is maintained through big decisions, surgeries, expensive tests, complex treatments. But in reality, the brain's strongest shields lie in the details, in small gestures repeated every day. Waking up slowly, taking your medication at the right time, drinking water before coffee, going straight to the bathroom, paying attention to your own body. These actions might seem too simple to be heroic, but that's exactly what they are: invisible acts of protection. And those who practice them aren't just avoiding illness. They're preserving something much greater, the continuation of their own story. Have you ever stopped to think about what's really at stake when we talk about strokes? It's not just a diagnosis. It's the risk of not recognizing the people you love, of not being able to sign your name, of not remembering where you left your keys, of losing control over your words, your legs, your identity. And that's why prevention can't be passive. It must be a ritual, a commitment. It's not about living in fear. It's about respecting what life has built so far. You built a family, you overcame hardship, you made it to 60, 70, 80 years with a unique story. Why put all that at risk with automatic behaviors? A stroke doesn't choose the weakest. It chooses the distracted. And that's where the ritual comes in. Not as superstition, but as quiet discipline. The routine you build today is what will secure your next years with clarity, independence, and dignity. Think of every morning as a real opportunity to strengthen your brain, to protect your words, your balance, your ability to remember names, dates, and faces, to keep being who you are, with clarity. Taking care of the mind doesn't have to be complicated, but it does require intention. It's like keeping a flame alive, small acts every day. In the end, it's not the grand achievements that define what we preserve. It's the small, quiet care we give when no one is watching. And that is the true power of someone who chooses to live with awareness. You've made it this far because in some way you understand what's at stake. And it's not a small thing. Throughout this video, we've talked about 5 habits that may seem small. Ignoring subtle signals from the body, getting the timing or dose of your medication wrong, drinking coffee without eating first, holding your urine after waking up, getting out of bed too quickly. On their own, each of these gestures may seem trivial, but together they're like leaks forming in the roof. At first you just hear the dripping, then the seepage, and one day the ceiling collapses. But unlike a house, you can't rebuild the brain from scratch. You may regain functions with effort, therapy, treatment, but it's never the same. And sometimes it's not possible at all. The good news is, prevention is in your hands, literally. In your fingers when you reach for a glass of water, in your eyes when you look in the mirror in the morning, in your choice to sit calmly on the edge of the bed before standing up. These details are not bureaucratic routines. They are acts of respect for what you've built, your memory, your speech, your presence, and maybe the most important thing of all, your autonomy, because no one wants to live as a burden. No one wants to be remembered as someone who depended on everything and everyone. Prevention is the chance to preserve the dignity you spent decades building. You're not too old to change. You're not too late to take care of yourself. And you are definitely not alone. If you've made it this far, it's because something inside you understands that living well requires choice, and choice requires courage. It's not about depriving yourself, it's about preserving yourself. Every morning is a real opportunity to start right, and when you start right, you protect not only your brain, but the people who walk alongside you. Comment below, I protect my brain every morning. Like the video if this content truly helped you. Share it with someone who needs to hear this, and subscribe to the channel to continue this journey of care, clarity, and life with presence.